Hello and welcome to this presentation on housing stability and support services, how a housing first approach can benefit clients and service providers. My name is Marty Malpe. I've been working with homeless adults primarily, but also families for about 20 years now. And this presentation is meant to be an introduction to what the housing first model is. It is for both housing providers and support service providers, clinicians, anyone who works with homeless clients. So a couple of things to let you know. This presentation is not meant to convince you that you should adopt Housing First. I'm not here to sell anything to you. My goals are to help you understand the Housing First philosophy and the elements of a Housing First approach. And from those two things, to be able to make informed decisions about how and whether you should apply the Housing First principles to your work. There are many things that go into understanding and running a Housing First program or a continuum of care that focuses on Housing First. And there are a lot of things that can get in the way of the effectiveness of a Housing First approach. So I'm going to discuss those things. Again, I'm not trying to sell you on Housing First because Housing First may not be an appropriate model for you, but I want you to be able to make those informed decisions. Now, a couple of things I want to point out first. This presentation will probably be about an hour. It was put together to be presented at conferences and stuff like that. When I do conference presentations, I really encourage audience participation. I like questions. I like to know that people are getting the information that they came for. Obviously, since there aren't any questions here, this will be a shorter presentation. Also, because there aren't any questions, there are probably some things that would come up during a conference presentation that I'm just not going to think to mention at this time in this presentation. However, I have included a bibliography from where I got all my information. So at the end of this, you can find resources and do some more of your own reading on how Housing First came into being and what it is and all of that fun stuff. I will also say I am recording this at the start of 2018. The research was done in 2017. So if you are seeing this a couple of years from now, there is probably a lot more information out there. There may be some specific to your area if other people have started doing Housing First. So do not just limit yourself to my bibliography. Go ahead and do a Google search for Housing First or Housing First approaches, anything like that. And you'll probably come up with some more recent information that I'm able to present here. However, like I said, I'm providing the outline and the basis for Housing First. That stuff will not change over the years, but there will be more detailed studies and things like that that will come out in the future, I'm sure. For today, we're going to define Housing First. We're going to look at its history, how it got started, what's in the documented results were, the goals, philosophy, components of a Housing First approach. We're going to look at some of the limitations as well, some of the variations within Housing First, and then some of the closing thoughts. So that's where we're going. The philosophy, goals, and components section is where we're going to spend most of our time. That's where we're really going to dig into what Housing First is, how it can be implemented, if it should be implemented. So when I was doing my research on Housing First and looking at the different ways it was described and studied, I should say, I found that there was no one definition for it. In fact, most of the articles I looked at did not provide any definition. They just described it and assumed that people would understand what they were talking about. So this is the definition that I came up with. Housing First approach is the provision of permanent supportive housing without requiring pre- or post-housing accomplishments or participation in support services once the person is housed, other than being able to maintain a standard lease. And this is a flexible model of service delivery. So what does all that mean? It means, as it says here, providing permanent housing that does have support services attached to it. Those support services could be something to do with physical health, mental health, chemical dependency, job training, some sort of re-entry coming out of correctional institutions, anything like that. So it's permanent housing. It does have support services attached to it, but there are no requirements in terms of what somebody has to accomplish before moving into the housing, and there are no requirements in terms of mandatory service participation once they are in their housing. And I'll go into that in a little more detail. Before I get to that, we'll talk a little bit about history pre-Housing First programming. And this is an oversimplification, but historically, housing placement was based on housing readiness. In other words, the idea that somebody had to demonstrate that they were ready for housing and willing to participate with support services before a housing agency would actually place them in housing. There were prerequisites, so somebody had to complete drug treatment, or they had to complete, fill in the blank there. This was part of a linear approach that said people coming out of homelessness, people needing these support services, should go into a highly structured environment where they would have lots of services. They would be required to participate in those services. They would gain housing skills, and then as they gain those skills, they would be allowed to move to less restrictive forms of housing, and the goal was eventually they would move through a continuum to the point where they had independent housing. Some people, it was just assumed they would always need support services. Some people, the hope was that they would get out of supportive housing altogether. But it was a continuum where you graduated from one type of housing to another. Now, a big part of this approach was that the professionals set the agenda. The professionals decided when someone was ready to move into housing. They decided when somebody was able to move on to the next stage of housing. They decided what the services were that the person needed and the intensity and all that kind of stuff. So professionals were really in charge of the agenda. Any clients or residents, whichever title you want to use, who didn't agree with the agenda were considered resistant or not ready to participate in housing. There wasn't a lot of focus on what the clients wanted because the clients weren't the professionals. The professionals. So this model had its share of critics. One of the big criticisms was that consumers or clients lacked choice. They didn't get to say what happened in their own lives. And so this led to, in the eyes of the critics, a lack of client engagement. They didn't get to choose what they wanted. They were being offered a bunch of stuff that they sometimes didn't feel they needed, and so they weren't very happy with this. Consumers wanted choice. They wanted to be able to say what goals they were going to pursue, and to a degree how they were going to pursue them. Now, another big criticism was that the housing was contingent on succeeding in treatment. When I've done this presentation at conferences and stuff, I ask the really silly and blatantly obvious question: how many people think it's easier to treat a homeless patient than a patient who has stable housing? And nobody will put their hand up. People come to this presentation because they understand that housing stability makes it a lot easier to provide services for individuals. But the traditional approach seemed to get things backwards, and it said, if somebody doesn't succeed in treatment, not only will they no longer receive the treatment, we're going to put them in a situation that makes it even less likely that they will be able to succeed and less likely that they will be able to attain any level of stability. So this was a criticism of this idea that to maintain your housing, you had to agree to someone else's agenda for what you needed in treatment. Now, those are some of the reasons why people said, oh, the clients don't want to engage. But they also said, even if clients do engage, there are problems. One is that this changing from one housing model and possibly from one housing location to another increases the stress unnecessarily that people are going to experience. So if you've ever moved, you know it can be a very stressful experience. So if you imagine you go into a housing program, you complete whatever programming there is, and then you have to move to another place. So you have to update your address with your therapist. You've got to let them know where you're living now, your probation officer, potentially you've got to figure out bus routes, all this kind of stuff. And then the same thing happens 6 months or a year later. And this keeps happening if you're one of the successful people. And they said this model really increases the stress unnecessarily that people experience. And they also said that living skills from one setting don't always translate to another setting. So like I said, the idea was that people generally moved into a more restrictive setting. And once they had achieved stability there, then they would go to a less restrictive setting. And the more restrictive setting would teach them certain skills that they would then be able to apply in their new setting. That sounds really good in some ways, but the critics were saying not all the skills that they're going to learn prepare them for less structured settings. In some cases, it even creates this mindset where somebody has to tell them what to do. They aren't sure when they are left without guidance what they should do in the new setting. So that was a criticism. And the final criticism, there are others, but the final one I'm going to talk about is that it would take a very long time for clients to reach their goals. If their goal is family reunification and to get their kids back, and they have to start out doing 6 months of some sort of residential program, and then they move to a halfway house, and then finally, a year and a half or 2 years down the road, they can move into a place that they might be able to have their kids with them. That can be a long time for clients. There's a really good chance that they're going to say, well, I think I can do it quicker on my own. I don't need these services. I don't need these rules. Or maybe I do need them, but I'm just not willing to wait. So these were criticisms that led to the genesis of a house. So the original Housing First programs stated that they had different values from the traditional approach. For a start, they viewed their approach to housing in terms of client rights. They saw housing as a right, not something that had to be earned. They could point to a lot of people who had stable housing, who might be very rich and famous, who had drug problems, who had mental health problems, who behaved really erratically, who were in and out of problems with law enforcement, all kinds of things like that. But because they were wealthy enough, or because they had enough resources, they managed to keep their housing. And if those people weren't behaving in a way that sort of earned them housing, they just had housing because of their resources, there was no reason why other people should be forced to earn their housing. Housing was seen as a right, especially because the housing stability made it easier to provide the support services. It made no sense to say these people need these services, but we're going to leave them in a position that makes the services less effective. Once they've gotten through that and proven that they can succeed with these services, then we'll give them the stability. That didn't seem to make sense to the original Housing First advocates. The original Housing First programs also valued client choice. Clients should be able to choose where they lived, what services they received, or what services they engaged in, I should say. They should be able to choose whether they got to live by themselves or with other people. A lot of choices that were not afforded to them in traditional housing programs. Now, the original Housing First programs also wanted to reduce people's vulnerability, get them off the street, get them out of shelters, get them into their own place where they could maintain control of their belongings, maintain control of who they interacted with, reduce their vulnerability. And the goal was increased housing stability that would result in part from the support services, but would also increase the effectiveness of those support services when they were offered. So that's, in a nutshell, advocates were looking for. They wanted to provide safe, affordable housing. They saw it as a human right. They said that homeless individuals and families deserve the same choice in housing as anybody else, that they had not really done anything to make them not eligible to have that choice. Again, a lot of people become homeless for various reasons. Some of it can be attributed to mental health problems, some of it can be chemical health, some of it can be a tornado comes along and wipes out a bunch of affordable housing. There's a flood, there's some sort of natural disaster. Plants closing, factories closing, people losing their jobs, not being able to find other work that provides a livable wage, and just not being able to afford housing. There are lots of reasons why people would become homeless, and these reasons do not take away their right to choose their housing. There's also the idea that, again, when consumers have a choice of what they want to engage in and what their goals are going to be, they become more invested because they're working towards something that they want to achieve. So these are all building blocks above. Now, last point here, the Housing First philosophy says that support services become more effective when a client has stable housing. Again, it's generally recognized when I do this presentation that homelessness does not make anything better. Homelessness makes provision of services difficult, it makes the services less effective, it creates all kinds of complications, it increases the risks for physical problems, mental health problems through the stress, chemical dependency problems. Nothing gets better with homelessness. So the idea is that support services, everything else becomes more effective when the client. So, how did the Housing First approach develop? Well, the best known pioneers of the Housing First approach were located at an agency called Pathways to Housing in New York City. Pathways was not the first agency to introduce Housing First approaches or elements of the Housing First approach, but they're the best known of the early programs. It was headed up by Sam Sembris, who's at the Department of Psychiatry at Columbia Medical Center. And this agency provided permanent housing without requiring the completion of residential treatment. Now, it's important to know Pathways to Housing had a very robust system of support services. As I'll talk about in a few minutes, they had ACT teams, they did have access to residential treatment. But this particular program, what they came to call the Housing First program, was a permanent supportive housing program that did provide permanent housing to people without requiring residential treatment. Now, they prioritized a very specific population. They were looking at chronically homeless individual. Chronically homeless is a federally defined term. To qualify, somebody has to have been homeless 4 times in the last 3 years, or for 1 year continuously, and have a disability. So, Pathways to Housing prioritized chronically homeless individuals, specifically women and the elderly, because they were at greater risk of victimization while they were homeless. They also focused on individuals with barriers to accessing other programs. So if they had a criminal history that would get them disqualified in a housing background check at other places, those were the sorts of people that Pathways to Housing was focusing on, and they would only take participants in the original study who had been diagnosed with a serious mental illness. So again, very limited, very specific target population, chronically homeless women and elderly with barriers to accessing other programs and a serious mental illness. Once they were in housing, or to get into the housing, the clients had to meet 3 qualifications. They had to maintain a standard lease. They had the lease explained to them, they understood what the requirements were, and they had to agree to do their best to live by the lease. They did have to agree to meet with program staff twice a month. Now, as I said, the provision of support services was voluntary, or the participation in the provided support services was voluntary. So they did have to meet with program staff twice a month, but those meetings could be very short. They could be, 5 minutes just to say, are you feeling well? Are you still alive? Something very basic like that. They would be offered a whole range of services, but it was up to them whether they wanted to accept those. They also were required to participate in money management because part of a lease is you have to pay the rent, and the clients did pay a portion of their rent, so they did need to show that they were going to be able to maintain their rent payments. They were not entirely responsible for the rent, though. There were subsidized rents through government grants, Section 8 vouchers. When you go back and look at how they funded this, there were actually quite a number of resources the Pathways to Housing brought in for the clients to pay their rent. In addition, the agency staff provided the support services using the ACT team model. So Pathways to Housing, again, had a really robust in-house system of services. So they were able to provide those services, offer them, but again, it was voluntary for the clients to accept them. Now, this program also used a harm reduction approach, and harm reduction is an entire presentation all its own. Basically, it says the client sets their goals. We'll use chemical health as an example here. They set their goals for the level of usage that they are going to pursue. If they want to pursue total abstinence, they can, and they will be provided with whatever resources they feel are necessary to achieve that. If they say, well, no, I don't want to be completely abstinent, I still want to use marijuana, but I don't want to use all the other hard drugs. The harm reduction approach says that that is valid, but the staff would sit down with them and say, okay, what's your plan to achieve this? How will you know when things are going off the rails? Is it going to be when you're using drugs in your apartment, which might be a violation of your lease and could cost you your housing? Is it going to be when you go and start talking with a dealer about other types of drugs? Is it going to be if you actually do use the other drugs? Let's say somebody says they want to continue their heroin use. They don't want to give that up. You could have discussions about is it dangerous for you to use alone? Will you only use with other people so that if you overdose, somebody can call the paramedics or can take some action to help you out? Those kinds of discussions would take place. So the clients would set their own goals and hopefully set their own benchmarks too for what was acceptable and not acceptable. Again, harm reduction is a whole other presentation that we can't go into in depth here, but it is part of the Housing First. So, Pathways to Housing set up this program, and they did some outcome studies in the mid-90s. Now, these were very well done. There was a control group. They looked at the variables. They did everything you're supposed to do when you do a clinical study. When they compared the Housing First participants to the control group, they found that the clients felt that they had more choice. They liked the flexibility in the program. They achieved a greater housing stability than the control group, which was really important. It showed that they were able to handle having a place of their own to a greater degree than people who were put through the traditional system. And by the way, if you want to look up the original studies and the reports on those, look in the bibliography at the end of this presentation. The articles are cited there. Now, one of the other things that they found was that the Housing First participants use the support services less than the control group, but they ended up with similar outcomes. So this sometimes trips up housing providers and clinical service providers. And they say, what's the benefit of this program and this approach if you get people into housing and then they don't engage in the services as much as if you required them, if you made it mandatory? There is another way of looking at this, though, and that's in the brackets there. You had similar outcomes, but with a less intense service provision. So basically, you were able to achieve the same outcomes without having to commit as many resources to that client, and that frees up resources for other clients. So one of the challenges that housing and service providers, especially in nonprofits, run into is the lack of resources. They say, we could do more if we had more resources. And that's true, but the other part of that, the flip side, is if you can find ways to be more effective with the resources you have, then that is certainly a positive. And what Housing First did was it allowed service providers to reach more people with the same level or the same amount of services, the same resources, without sacrificing quality. So you may not have a larger success rate, but you have a larger reach into the community. You have more clients without increasing your resources and without decreasing your quality. So that part is important. Now, all of this led to SAMHSA recognizing Housing First as an evidence-based program in the early 2000s. There are a couple of things we're going to rest on this point for a few minutes because the way this came about has led to some misunderstandings and some caricatures of what Housing First is. So the first thing I want to point out on this slide is that Housing First was recognized as an evidence-based program. It is not considered an evidence-based practice. What that means is Pathways to Housing ran a program they called Housing First. That program, with its ACT team, with its limited focused target population, that's what got recognized as evidence-based. And there's a reason I'm harping on this. Like I said, this happened during the George W. Bush administration. So, a couple of things to know about George W. Bush administration. It was really focused on evidence-based policy. Now, the most well-known of its evidence-based programs and policies was the No Child Left Behind Act, which said we're going to look at standardized test scores, we're going to see which schools are producing the best results, and we're going to pay them for what they're doing. The schools that are not showing good outcomes on these standardized tests, we're going to reduce funding to them. Now that's a very simple explanation with No Child Left Behind. It's more complicated than that. But basically, the approach said, you have to show us that what you are doing is effective to receive funding. The problem is, you may not have clear guidance on what evidence was needed. Now with school kids, it's easy to do standardized tests and to see who scores higher and who scores lower. With a housing program like Housing First, there are any number of outcomes that you can measure. So you can measure public costs, you can measure recidivism, whether chronic homelessness is going up or down. You can measure health outcomes. You can measure the effectiveness of the support services. There are all kinds of things that you can look at. But this is a socially conservative administration, and Housing First is a socially very liberal program. We're going to give people housing. We're going to pay most of their rent. We're not going to require that they earn this in any way. We're not going to require sobriety. Those are very liberal ideas. So how do you get a socially conservative administration to accept a socially liberal program and policy and approach and get them to give it their stamp of approval. Well, you don't look at the social side of it. Housing First was really pushed in terms of decreasing public costs, reducing chronic homelessness, which was great for the business community and livability and all that kind of thing. The Bush administration was fiscally conservative, arguably, but the idea that you could use this approach to reduce public costs and reduce chronic homelessness, those did appeal because chronic homelessness is really expensive. Chronic homeless individuals use the emergency rooms a lot. They have a lot of encounters with police. They end up in detox centers and incarceration quite a bit. And this costs a lot of money. And the Housing First program was able to show that they were able to reduce costs to society by paying for housing rather than paying for all these other things. So that appealed to the White House. And that's one of the factors that led to the Housing First program and Pathways to Housing being recognized. However, this has led to an oversimplification or a misunderstanding of Housing First. Housing First is known by some of its goals and not all of its goals. The primary goals tend to be stated as reducing the episodes of homelessness, prevent recurring homelessness. In other words, improving people's housing stability, getting them into housing, keeping them there, which reduces the cost of the system and reduces chronic homelessness. Those are the kinds of things that Housing First is generally. Other aspects of Housing First kind of got pushed to the background. Now, these were still verified by the studies that Pathways to Housing did. They just don't get as much attention and as much press. So, improving the effectiveness of the support service agencies, I should say. Again, the actual effectiveness of the support services didn't really go up, but the effectiveness of the agencies in terms of reaching more people, being able to spread out their resources more, that improved. There was a reduced trauma caused by homelessness, which led to hopefully a reduction in the intensiveness of the support services that were needed. There was an improvement in health and well-being, increased economic independence. These were all measured results of the Housing First program, but they didn't get the same attention. And so a lot of times when people talk about Housing First programs now, what they focus on is you provide housing, you don't put a lot of requirements on people to qualify for it. You get them into housing. You don't require them to participate in a lot of support services, although you offer those. And then the results are lower cost to the system, et cetera, et cetera. It's not quite that simple, though, and we're going to talk about that a little bit. There are certain concerns about the way Housing First is now understood and the way it is sometimes implemented. By making the economic argument primary, because the Bush administration was economically conservative, what happened in some people's eyes is that client well-being became a matter of economics, not a matter of what was necessarily best for the clients. So if somebody can function well in a Housing First program, or if a Housing First program is offered to them and is viable in a certain community, that's great, but Housing First doesn't work for everybody. And if somebody needs a more expensive or a more intensive approach, then the question becomes, well, why can't they do Housing First? Your solution will cost more. Housing First is cheaper. You know, that assumes that Housing First is going to work. And we'll talk more about that when we talk about assessing whether Housing First can work. Another concern is that just by the name Housing First and by the approach you do the housing and then worry about the other issues afterwards, again, that's a caricature. But the concern is that the focus is too much on housing and there's not enough priority given to health issues. So this also, another criticism, is that it understates the values and client rights in policy discussion. Again, when this was presented to SAMHSA, when they got the evidence-based program designation, they focused on the economics of the situation. And they didn't speak a lot about client rights because that wouldn't fly well with that administration. Another concern is that this doesn't consider the reasons for a person's homelessness, and to use No Child Left Behind as a comparison again. One of the concerns with No Child Left Behind is that just looking at standardized test scores, you could have a very well-funded suburban school that was achieving great results because there were lots of community resources. The students had stable homes. There were lots of extracurricular activities, and you were trying to compare that to underfunded, overcrowded inner-city schools where there was lots of violence in the neighborhoods, lots of stress on the students, not enough food at home, things like that. And you were taking away that context and just judging by the standardized scores. Same situation with homelessness. If you just say, well, the Housing First approach says you put people in housing and you provide or you offer some support services, it doesn't look at the reasons people are homeless. One of the reasons a Housing First approach may not work is you just don't have places to house people. In the aftermath of Hurricane Katrina, for example, housing got wiped out. People were relocating to all different parts of the country. You couldn't just go into New Orleans at that point or any of that area and say, well, we got lots of homeless, let's do Housing First. You didn't have anywhere to house people. So that's an example of one thing that can sabotage a Housing First approach. And we'll talk about some others in a few minutes. Those are some of the criticisms or concerns about a Housing First approach and just trying to implement it without fully understanding what is involved. So, how do you fully understand what's involved? Well, this is where the Housing First components come in. And the one that we're going to spend the most time talking about is an assessment-based targeting of Housing First services. You have to do a lot of assessment before you start Housing First if it's really going to be effective. You could get lucky and start Housing First programs and you happen to have all the right resources or you happen to set things up in a way that's going to work. But things are more likely to work if you do take the time to assess what your resources are and so on and so on. And we'll spend several slides talking about that. Another component of Housing First, like we've talked about before, low barriers. Don't try to make people jump through a bunch of hoops that they don't have to. The Housing First programs do help with locating and securing housing. That includes paying the rent, making sure that the person can sustain the housing as much as possible once they're in there. And that goes through partly the rental assistance, but also the provision of the appropriate support services. Again, the main requirement is that the person be able to maintain a lease, being able to pay the rent as part of the lease, being stable enough to not lose your housing, to not go running through the hallways naked, having delusions, if you want to take a really extreme example, but also being able to get along with your neighbors, not threatening your neighbors, understanding that you need to play your music quietly enough that you don't disturb the community. Those are all things that can come through the provision of appropriate support services if they aren't things that somebody understands before they move into housing. So being able to provide those appropriate support services. Again, Not much use having a lease if you have serious medical problems and you really can't take care of yourself. If somebody needs in-home medical care, do you have the resources? Let's talk about these assessment questions. There are a lot of them. So when you start this, you want to look at the resources and the funding sources that you have. What are you able to do? If you have great outpatient mental health services, if you've got ARMS teams and ACT teams and all kinds of stuff like that, if you've got those resources, you can probably work with clients who have some fairly serious emotional and mental conditions that will need some intensive help. And if you can pay for those sources, that's great. If your community doesn't have a robust mental health system, you may look at that third question, who will we prioritize? Well, you may not prioritize people with mental health conditions. You may prioritize families. You may want to focus on kids. You've got a really good educational system. You want the kids to be able to go to school, to know where they're going, to be able to engage regularly with the same teachers, so you may prioritize them. These are the sorts of questions that you want to ask, and you want to make sure that you know who you're going to focus on. This is also really important for that fourth question. What partners do we have? Can the school district be involved? Does the local chamber of commerce want to support this because they want to reduce the number of people who are out on the street panhandling in front of businesses? Do you have the local hospitals and healthcare providers on board? Each of those partners is going to have a different set of goals and a different set of measurements that they are going to want. You're going to want to agree on what outcomes you're going to try to achieve with this and what population you're going to achieve it with, so that everybody who's involved knows what's going on. And you may end up with 6 different goals depending on who's involved. You may have the Chamber of Commerce saying we want less homeless, less people visibly homeless in the business area. You have the housing providers saying we want to decrease chronic homelessness by 20%. And you have healthcare providers saying we want a 20% increase in the attendance rate. When people have medical appointments, we want them to actually make it to those appointments. And you have the school saying we want to see an increase in school attendance, all of these things. So let's say you come up with a list of 6 measurements of success. How are you going to measure those? If in the end you only achieve 4 of them, is that enough? Are the groups whose goals were not achieved, are they going to pull out because they say they're not getting anything from this program? Or are they going to say, well, we're not seeing the results we want, but we are seeing that there are results? These are all discussions that should be had early on in the process. And then the question, what changes have to happen to make things viable? Do you need more resources for paying rent? Do you need more mental health services? So if you're setting up a Housing First system, you're going to look at system-wide questions. So where are you going to house people? What sort of housing is available? Are you looking at 1-bedroom apartments, or are you looking at 2- or 3-bedroom apartments? Meaning, can you house singles, or should you be housing families? How are you going to pay for these, for the rent? Do you have enough rent subsidies for 100 units or just for 20 units? Those kinds of questions. Public transportation. If people are going to be using public transportation to get to their appointments and to engage in the support services, does that limit where you can place them in the city? If you're in a more rural area, do you have public transportation at all? If not, are case managers going to be expected to drive clients to and from appointments? And if they are, then that's going to affect how many clients you can serve. So there are a whole bunch of different aspects of this that you need to think about to make sure that you're setting your program up. So also on the system side, you can talk about what support services are available in your area. Do you have outpatient services? Do you have teams that can go and visit the clients in their homes, or are they going to have to come to you? How much time can be allotted to those clients? All of these are questions, again, that need to be discussed. So, again, the funding questions as well. Do you have rental subsidies? Who is going to pay for these services? Is it going to be through medical insurance, through one of the exchanges that some of the states have? Is this going to be through fundraising done by individual agencies? Is this something that the county is going to pay for as part of a Housing First program? And then the question of housing development and redevelopment. Do you actually have enough housing available? Are you going to be working with private landlords, or do nonprofit agencies need to develop some housing? These, again, to affect how the Housing First program is set up, if it gets set up. So we've already talked about this a little bit. What are the systems, or the participants, or the funders, whatever phrase you want to put in there? What are the priorities? Are you saying that you are going to reduce visible homelessness? Are you going to reduce costs to the system? Reduce the vacancy rate if you got a bunch of private landlords involved in this? Are you targeting specific populations? These are all questions that need to be. So, answers to these questions will indicate whether Housing First is feasible. Again, I said, the example of if you don't have housing available, don't try Housing First is possibly where you end up. If you have housing, but there's a 3 or 4 month wait period, and you have residential treatment programs where people are being discharged to homelessness, you may say, well, we could do Housing First, but we have a group of people who've achieved some stability, and they're having to go into a situation of homelessness, of lack of stability, before they can get back into a stable situation. That doesn't make sense. Maybe we're not going to do Housing First. Maybe we're going to say we're going to prioritize people who are coming out of treatment programs. So this is one of those questions. Is Housing First feasible? Is it logical? Are there other approaches that may work better? One thing I don't think I mentioned yet, but as I've done my research and as I've talked to Housing First advocates, I haven't come across anyone who says we should get rid of residential treatment and halfway houses and everything and just do Housing First. Even the staunchest Housing First supporters realize that there are other forms of housing that are needed by certain people. That doesn't mean that they won't at some point in the future be ready for Housing First. It doesn't mean that Housing First should not be considered. It just means that Housing First is an approach to housing that will work really well in certain situations, better than other approaches in certain situations. But you have to do these assessments to figure out whether you are in one of those situations or whether you need a combination. So, again, these assessments will help you answer, is Housing First feasible? If it's feasible, what populations will be targeted? It might be feasible with some populations and not others. How many units can you serve? How many families or how many individuals? And what resources other than housing providers can be involved in the system? If you don't have a robust outpatient mental health system or a robust system of healthcare providers, you may end up saying we're going to do Housing First with people who have less intense needs. And the people who have the higher needs, well, they are going to have to go into a more traditional housing program or more traditional set of services. Having one system, again, does not exclude the system. So, this is one of the joys of Housing First and also one of the challenges. The original, or I shouldn't say the original, but the Housing First program at Pathways to Housing again, focused on a very specific population and had the services to back that up. They also had their own housing, or if they didn't have their own housing, they had the resources to pay the rent and to guarantee the housing. Depending on your situation, you may be able to work with lots of different landlords and have scattered site housing, or you may have agencies that are able to provide scattered site housing. You may end up using site-based housing. This can work with families or singles, could work with youth or seniors, can be added to existing systems, or it could be started entirely from scratch. Again, could work with rapid rehousing. People who have not been homeless very long, who have the resources, they just need to get back into housing quickly before they get trapped in a homeless cycle. Or you could focus on ending chronic homelessness. There's a huge variety in each of those categories. And when you start mixing and matching and realizing, well, we're able to do a scattered site family program, but for the singles, we have to do site-based. And we have these resources available for seniors, and we've got lots of good resources available for veterans. The schools can supply this for the kids. It can become very wide-ranging and very complex, or it could just be something very simple. Is that you can set up a complex system across an entire continuum of care. You can also have a specific agency or one program within an agency that says we're going to work on a housing first basis. The two are not contingent on each other. So if you have an agency that says we're going to do a housing first approach, they don't need the entire system to shift to their approach. At the same time, you could have a continuum of care that says we really want to prioritize housing first. That doesn't mean that every agency in that area has to do housing first. Again, nobody argues that you should get away with hospital psych wards or residential treatment or all the other forms of housing. Housing first is an approach that doesn't negate the others. So you can have housing first in concert with other approaches. You can have it by itself. They're not mutually exclusive. They're also not. So, some closing thoughts here. Housing first is not a magic label. It's not a magical approach. It does have to be planned out. It's not appropriate to just say, well, we're going to do housing first. We're able to give a half hour of case management or an hour of case management a week if the person wants it. And we're going to take the most seriously mentally handicapped or mentally disturbed individuals and put them out in the suburbs somewhere away from the services that they're used to and hope that the case manager is able to keep them stable. Just doing housing first by itself doesn't guarantee success. Again, it has to be thought out. It has to be set up appropriately. And I've already gone over this quite a bit, so I won't belabor the point. But housing first and non-housing first approaches can coexist. Housing first is a tool that is suitable in certain situations, but not all situations. And housing first considers housing to be a first step. It's not the only goal. It's not just get people into housing and then, good for them. Housing is meant to end homelessness, but it's also the basis for accessing those other services that the client wants, whether it's mental health treatment, chemical health treatment, going back to school, getting a job, family reunification, all those different kinds of things, getting involved in a faith community, having a home, or home in the sense that you have a community that you can go to and feel comfortable there and get resources there and be able to contribute in a way that is very difficult when you are homeless. So housing is a basis for all this other stuff. It provides the stability to pursue all those other things, but it is not the complete end goal all on its own. Vocabulary is really important. Housing providers tend to speak in terms of housing as a human rights. It's a justice issue. We need to provide enough housing. We need to make sure it's affordable. All these kinds of things. Funders do value return on investment, going back to the evidence-based programs and evidence-based practices. I know a lot of people, a lot of service providers are kind of cynical about that. It takes a lot of time to demonstrate the return on investment. At the same time, housing is expensive, services can be expensive. We want to make sure that we are doing them well. We should be able to show that the money that's being given us is producing certain results. So that's what funders look for. Are you able to show that you are producing results? And again, somebody has to define what those results are, but as long as you can show that you are making a difference, then that's what the funders look for. And meanwhile, educators, chemical and mental health providers, the clinicians, they like talking about housing stability because, again, homelessness doesn't make anything better. It doesn't make the services more effective. It doesn't make it easy to keep track of your client, to stay in touch with them. There's added stress on them. There are all kinds of reasons why homelessness is debilitating. So housing stability is really important. But again, if the housing providers are talking about a justice issue and the funders are talking about effectiveness and the clinicians are talking about housing stability, all of those goals can be achieved through Housing First, but it's going to be harder if they don't realize they're all talking about the same thing. So as you explore Housing First and as you talk with other people about it, be aware of differences in vocabulary. I did promise a bibliography. This is it. We've got the websites for all of these documents. There are many other documents out there. There are going to be more documents in the future. So again, do not just limit yourself to these. These talk about how Housing First developed, the limitations, the strengths, things. So I hope this has been useful to you. I wish you or services you are providing, and I thank you for taking the time to watch this presentation. Have a good day.